If you ask most people which is worse for cancer risk, one really terrible sunburn or many moderate sunburns over the years, many would probably guess that the severe burn is more dangerous. It makes intuitive sense. More immediate damage should equal more risk. But the biology actually tells us something quite different, and understanding this distinction is crucial for how we think about sun protection throughout our lives. A single severe sunburn certainly isn't good for you. It causes substantial cellular damage, triggers intense inflammation, and can definitely increase your cancer risk. But your body is actually pretty good at responding to acute damage. When you get one severe burn and then avoid sun exposure afterward, your repair systems can focus all their resources on fixing that specific injury. The inflammation resolves, damaged cells either repair themselves or undergo programmed death, and over time the tissue can return to something close to normal function. Repeated moderate sunburns present a completely different biological scenario. Each burn might not seem as dramatic individually, but what's happening is that you're never giving your cellular repair systems a chance to fully recover. It's like the difference between lifting one extremely heavy object once versus carrying moderately heavy loads repeatedly throughout the day. The cumulative stress can actually be worse. Here's the critical mechanism at work. Every time your skin gets UV damage, even if it doesn't result in a visible burn, your cells activate their repair machinery. This repair process requires energy and resources, and it's not perfectly accurate. With each cycle of damage and repair, there's a small chance of errors occurring. If you're repeatedly triggering this cycle, year after year, those small chances add up. The probability that some cells will acquire permanent mutations increases with each exposure. Additionally, repeated sunburns keep inflammation in a chronic, low-level active state. Instead of having one inflammatory event that resolves completely, you have ongoing immune activation that continuously remodels the tissue environment. This persistent inflammation is what creates the conditions that favor abnormal cell survival and growth. It's not the intensity of inflammation that matters most, it's the duration. There's also the issue of cellular aging. Each time your skin cells divide to replace damaged tissue, their chromosomes get slightly shorter. This is a normal part of aging, but it happens faster with repeated injury. Cells that have undergone many rounds of damage and repair are essentially older at a biological level, and older cells are more prone to malfunction. From a practical standpoint, this means that consistent sun protection throughout life is far more valuable than occasional protection. It's better to use sunscreen every day and avoid all burns than to be vigilant only during beach vacations while ignoring daily exposure. The everyday UV exposure, the casual walks outside without protection, the driving with sun on your arms, these all add up over decades and create that pattern of repeated injury. What makes this particularly relevant is that many people have the opposite approach. They're very careful on vacation, applying sunscreen religiously for a week at the beach, but then ignore sun protection the rest of the year. But it's that year-round, habitual exposure that's really driving long-term cancer risk. The biology clearly shows us that preventing repeated moderate damage is just as important, if not more important, than preventing occasional severe damage. This should fundamentally change how we think about daily sun protection as an ongoing health habit rather than something we only worry about in extreme situations.